We would like to speak in this talk how you can enhance healthcare quality using reinforcement learning modeling. Currently, medical diagnosis can be inaccurate due to inefficient number of measurements, inaccurate analysis, and sometimes because it is human biased or limited computational resources. This leads to unnecessary operations that can cause damage and cost a lot of money. It can lead to wrong type of medication, and it also leads sometimes to negative effect of under or overdose of the drugs. All this decrease medical treatment efficiency, and we need to find way to enhance medical treatment efficiency. The goal of this talk is to design predictive model for personal medicine to maximize the medical treatment efficiency. We suggest to implement it by reinforcement learning model with two agents: the natural that imitate the natural response of the body, and medical agent. The scope of this work is as follows. First, we'll describe shortly reinforcement learning for the metals. Then we'll suggest our model, which is the natural medical dual agent reinforcement learning. Then we show shortly how we can constrain the reinforcement learning by interesting constraints that can enhance the medical, or they are more realistic for the medical treatment. And then we'll conclude the work and speak about some future work. Reinforcement learning is part of machine learning. It is inspired by the brain and includes agent and interpreter. The agent seeks to perform an action. For instance, here the action is picking an apple to eat. And it tries to do it by continuously interacting with the environment. So here, like, the action tries to predict to maximize the future reward based on the current state and the instantaneous reward. So we can define like the cumulative future reward is when we eat the apple. We can define the state as stages toward eating the apple, which can be the distance from the apple, if we are grasping the apple, etc. And the instantaneous reward is how close we are to our goal, to our instantaneous goal. So every time we perform an action in the environment, then the interpreter calculates from the environment, based on the environment, the instantaneous reward and the state, and they are as input to the agent to design by a certain policy the optimal action. Here we describe an example for the natural agent, which is in the same example from before of eating the apple. We see that in the brain we have representation for internal states, and then we decide using decision making in the brain using a policy. We decide which motor command we shall utilize to get our eating the apple task. In the interpretation, we estimate the instantaneous reward, the instantaneous state. We compare it to the desired response, and then we send the feedback for the evaluation of the next action. The suggested natural medical dual agent reinforcement learning. It includes of both agents. Again, the natural agent the reward is related to internal subject return, as we saw before. It is not fully known, and it is sometimes based on biological principle of homeostasis. The medical agents is related to the medical system. It can be related to healthcare provider, and the reward is in reference to medical baseline. So the medical agent interpretation can be based on external software utility and action tools, and the sensors can be like a video camera or sensors attached to the body, etc., etc. While the natural agent, the sensor is the real body sensors, and the computation is performed by, decision is performed by the brain. The natural and medical agents can collaborate. We define full collaboration when the reward is similar to all agents, and partially collaboration when there is just overlap between the reward. Since we cannot estimate fully the internal body reward, we need our model to be designed by partial collaborative reinforcement learning modeling. Previously, a medical agent did not try to estimate the natural state. It was just a simple controller. We suggest in this work that the medical agent estimates the natural reward and predict the natural policy and action through observation, through medical data priors, and direct reading, if it is available, of the brain of the reinforcement learning model. The action estimation of the medical agent is as follows. In addition to the traditional criterion that we showed before, that is based on the medical state and the medical instantaneous reward, we also condition it also on estimation of the natural response. So we in this work we actually try to continuously estimate what would be the body response, and we try to make the action of the medical agent accordingly. And for this we also utilize medical priors, which can be any medical prior. It can be like the physician knowledge, it can be medical database, it can be computer with medical software, etc., etc. Estimation of the state is performed previously as before, but for the reward we can say that we take also into account, like we saw before, the other agent action. So the other agent action is also in the consideration of how our reward is towards achieving the task. We showed before this scheme of the natural agent of picking an apple, and now we can see how the collaboration between the two agents is performed. First, there is the medical action, which can be prosthesis of the hand that can assist the hand with people, handicapped people, to pick up an apple. Then we have like the external sensing, which can be some accelerometers attached to the body. Then we also have behavioral goal, which is like of the software utility that of the medical agent, and they are both sent to the interpreter using sometimes medical database that represent the priors, medical priors, and then we calculate the current medical state and the reward, and then we can send it to an action utility that can actually control the processes. And then we can also use it directly to brain stimulation and sometimes to drug adaptation. And then we can also assess the brain signal directly from the brain if it is available using like EEG or deep or some internal electrode. And the brain signals can measure like the internal states, and it can also measure the internal reward from the basal ganglia, for instance. We can add to the dual agent reinforcement learning some constraints. The constraints can be medical to maximize the medical intervention, or to minimize the medical intervention, or to maximize the self-healing. It can be to take care of the economical constraints, and also like to make every action to be more um, easy or more comfortable to the patient. So let's conclude. In this work, we provided external medical complementary mechanism to the internal natural one. We developed initial mainframe for predictive model, reinforcement learning model of the subject and the medical system. Let's look on this table that summarizes the result. First, we see that sensing-wise, we have more sensors, which means the internal and the medical ones, which mean that we can correspond to the environment or to the disease better. We see that we have, in addition to the brain, we have also like external software utility, and we see that we, in addition like to the action, natural action, we can also have additional medical action. And so also reward-wise, like for instance, if we would like to eat an apple, then the person needs to eat an apple would be to eat as much as possible, but then we can increase the sugar level. So if we aggregate to this also continuously, the diet restriction of based on medical knowledge and based on the subject, then we can get it like very nicely and seamlessly, unlike other paradigms in the field. Same, we can also use like a personal training mode that we have more restriction, but it is better for the long reward goal. And again, as we emphasized before, we can use different constraints, for instance, to take into account the maximum healing and then to have minimal intervention. So the new model has potential to improve health quality with better control of the desired level of future work can be to find explicit solution to different medical uses and applications, to implement the model in real-life scenario in real time, to analyze different constraints, how they affect the solution in real life, and to use, of course, deep learning, reinforcement learning. Thank you very much, and thanks to Bar-Ilan University and to Professor Roy Chaffee.